Hey, Dental Nachos crew. I want to sit and talk with you guys for a minute about how we are handling emergency patients during this crisis. I'm Paul, Dr. Nacho Goodman, and we are facing something that I've never faced before in my 17 years of dentistry, and that we can't just say to emergency patients, stop in tomorrow, let me see your tooth. You can come in between patients, something that we're used to doing. So I have awesome key resource and sponsor, Driven Dental Marketing, Charles, here with us, because they have a platform they're developing that's going to help you stay connected with your emergency patients, help you connect with other patients in the area that are having emergencies, and most of all, really get your practice ready for when we reopen. And Charles is going to share some things with us about that. So thanks for being with us here, Charles. Share with us what you guys do to help dentists, and especially about this new platform you have.
Hey, yeah, thanks for having me. So yes, I mean, like you're saying, this is totally unprecedented times. Crazy things going on right now. A lot of doctors are kind of nervous and worried and not sure, how to keep their practice going. What Driven Dental Marketing has done is we've shifted from our regular focus of, helping doctors attract, high value implant cases, taking all the skill set that we learned from running those campaigns really well with digital marketing campaigns. And we've shifted to helping doctors stay visible for the patients who are actively searching right now for an emergency doctor, emergency dentist. And so just because this coronavirus situation has happened does not mean that the emergencies have stopped. I mean, in fact,
Right.
now, even more than before, there's a higher sense of urgency because patients can't find dentists that are open. And so they're going to Google, they're searching who's open right now, who can help me, I'm in pain, I need some help. And we are helping doctors stay visible in front of those patients.
And one of the things that we were talking about, and I want to share with, so I'm a practice owner of two practices. My brother, we've had patients under these practices for over 60 or 70 years. So we have a whole nacho plate of patients. And one is really your verbal skills and being, patients are asking, are you open? Which most dentists are going to say no, but it's more, are you available to help? And being available to help can be through a virtual consult. We've had some here nachos. Share with me how some of your clients are using virtual consults to triage and figure out what's going on with patients.
Sure. So first off, what we're doing is we're again establishing them on Google, send them to a landing page that says, "Hey, we are available. Here's the different ways that we can help you." Part of that landing page is actually like a COVID-19 update, and most doctors I've seen already have these on their existing website. But it outlines exactly what are the procedures and things that we're seeing right now, who are we not seeing, and what additional precautions are we taking into practice to keep everybody safe. All that's on the web page. They also have an opportunity to book a virtual visit with the doctor. So we put the portal to get into a virtual consult right there. They can request to see a doctor without wait time, without having to go to an office or anything like that. And now they can chance to talk to the dentist, share via video what's going on, and get an answer about what happens
I
next.
mean, we've been doing that, and it's been really helpful because it's really about managing all of your calls, managing all your requests. And no one knows, as dentists are in a state of uncertainty. It's tough. We don't know if we're going to be open next week, probably not. Next month, hopefully so. But in this time, we talked about before we jumped on here, we really want to be preparing our practice to be successful when we do reopen. So in utilizing your guys, Google AdWords and getting attention on this, what can dentists do to be ready with cases when they reopen, and especially with some of your implant marketing thing, which I know you have paused, but you've said you found out how this kind of fits into it as well.
Yeah, well, so first of all, emergencies are always going to be around. So if you don't have an emergency campaign right now, this is an excellent source of steady new patients to your practice. Setting this up now is going to basically give you at least the opportunity to have conversations with patients, pick and choose who you feel comfortable with seeing and bringing them in right now. That can give you a little bit of at least production to cover your costs and stuff like that, so you can be okay. But you're also establishing, these are patients that will be grateful for you being available to them, and
Right.
they can become part of your practice in the future. So that's setting you up. And also with the virtual consult infrastructure, you now have a whole new path of how potential new patients and existing patients can communicate with you in your practice. And I don't think this method of communication is going away. I think this is going to be the new standard of how we practice healthcare. And this is going to be something that patients will expect in the future. So they don't have to take off work. They don't have to get a babysitter or drive across town to get their questions answered. And I think it's going to be especially relevant with high value dentistry. So with implants and stuff like that, especially when there's a longer decision cycle, patients need to have their questions answered. We need to kind of get a ballpark idea of what types of procedures and especially cost. We can even get them pre-approved for financing. All this can be done via virtual consult before they even walk through your door. So when they
I'm
do
so
show
into
up,
that
yeah,
now.
they're in the right mindset.
I call that the magic of momentum. People
Yeah.
lose momentum. So if you can utilize virtual consults inside emergency time during the coronavirus, but also outside for everyday stuff, it'll be so great to just sit there on a virtual consult and connect with the patient about what implants do, what they can do. They'll feel more comfortable. You'll see them face to face. So I was talking about unintended good consequences of this, and I think that's one of them. I think after we reopen, utilizing virtual technology in a better way than we have before is going to be great for dentistry. It's going to decrease annoyance. It's going to help us with case acceptance. It's going to help our team. So I think what you guys are doing are great here. And I want to share that this is the time to be available, like my brother and I are trying very hard to do. Be available to talk to people. We got a new patient. And when I say new patient, we got a new person, right? Because a new person called our office, got our emergency line, and she said to my brother, I'm really just so appreciative you picked up the phone. And she didn't need to come in. She didn't even have a big problem. But I think this is just a time, if you think about it, Charles, I never thought this would happen. We're not seeing people face to face. We don't feel connected. So anything that your dental office could do to be a leader in that is going to be awesome.
Yeah, I 100% agree with you. And that appreciation goes a long way. I mean, these can be future patients for your practice. They can even refer without even having come into your practice because they had such a good experience and they're so grateful for you being available. I think another thing to take into consideration is think how hard it is to implement a new system during regular times in a dental practice. We got so much stuff going on. Well, now we have the time and the bandwidth to actually focus on setting up these new infrastructures, really get great at doing virtual consults, because that's where we're going to spend all of our time and attention. So by the time things get back to normal, this is going to be something we can implement into our regular busy schedules
Very
pretty
true.
easily.
And this
Yeah.
is also something that you really can bond with your team about, because your team can start helping with these things too. And I think one of the things you said at the beginning is important, that, dentist, this has never happened in dentistry before. And most dentists don't work remotely at all. And now we're just stuck. So anytime to say words that we're used to saying, to connect with patients makes us feel more normal. Like I can imagine, Charles, like if you couldn't work out for 30 days, lifting 100-pound weights, if someone gave you a 5-pound weight, you'd feel a little more normal, right? You'd
Yeah,
feel,
exactly.
at least I'm doing something. And I think that's the same thing. It happens with injury in athletes, right? You see those guys on the stationary bike. Yes, they were NFL players, but at least they're on the stationary bike and they feel like they're a step closer to playing again. So that's why I encourage dentists, because I've had some resistance, even from my own personal friends. I don't want to do virtual consults. I say, just do it. You're going to be glad you did it. You're going to start to exercise your words again, and you're going to be able to bring about some positivity in this sea of annoyance that we have going on.
Yeah.
So I really appreciate you guys being a key resource sponsor. Tell people if they want to learn more about Driven and you doing this with them, how could they do that?
It's super easy. Just go to drivendentalmarketing.com. And on that page, there's buttons to book a strategy call with me. And we can talk about your specific situation, and we can figure out all the details and figure out what's next. So just drivendentalmarketing.com, find the button to book a strategy call, and just get on the schedule. I'll be happy.
That's perfect. That's a 2JFO. Just find out, guys, how this can help you. And whether it's for emergencies, whether it's for implants, whether it's for a hybrid of this, I think we're going to learn a lot of things this challenging time, and doing this connecting virtual is part of it. Thanks, Charles, for being on this. Ariel, take us off, but really appreciate you chatting with us.
Thanks for having me.
My pleasure.